Well, hello everyone. How are you? This is Dr. Ruben Valdes of drvaldes.com. Super excited today to be tackling a topic that for me is one of my favorite things to talk about, and that is normal TSH ranges. Okay. The first thing that I want to say and really address is the fact that most doctors manage thyroid problems by just looking at TSH. That is completely insane. And the reason is TSH is only a shadow, it's only a reflection of everything else that goes on with thyroid metabolism. There's so many people that are considered to be in a normal TSH range and yet continue to experience eternally the same symptoms of thyroid disorders. There's many reasons for this. And the one that I really want to be able to address today is the fact that most lab TSH ranges are, pardoning my French, total garbage. And so it's important to understand that thyroid metabolism is complex. Whether you're supplementing the hormone like with Synthroid or Levo or anything natural like Nature Throid or Cytomel, GTA, whatever you're taking, once that hormone is either produced or supplemented, it goes through a series of steps to become the actual activated form of the hormone, which is T3. Now, sometimes there can be issues with conversion into an inactive form of T3 called reverse T3. There can be a lot of issues. And so this is one of the main reasons why people with normal TSHs, continue to experience a lot of the same thyroid symptoms. Now, the thing that I want to address is the TSH range itself. Depending on the lab, the most popular out there is between 0.45 all the way up to 4.5. As you can see, that's a pretty gigantic range. You can drive a truck through there. Many women that are on the upwards end of that range and many that are in the low end of that range have really interesting symptoms regardless of being told that their TSH is normal. What we're now learning is that optimal TSH is it's a very strict range. It lives between 1 to 1.5. That's it. As people start trending away from that 1.5 and up, we know that symptoms of hypothyroidism will become more and more prevalent. Now, when that range goes from 1 to lower, the patient will start mimicking a hyperthyroid sufferer. Now, it's interesting how so many patients have come to me in their own efforts to help themselves, and they've increased their dose of hormones, whether it's synthetic or natural. It's the same thing. Well, not exactly the same thing, but close. They've continued to increase, driving their TSH way too low. What we've learned is that this is actually really, really dangerous because it produces irreversible damage to the heart, the brain, and the adrenal glands. It mimics hyperthyroidism. It causes arrhythmias, it causes issues with the pituitary gland, it dysregulates the hypothalamic pituitary adrenal axis. So it's a very, very bad strategy, and it's actually very common. To me, it's almost irresponsible to have somebody on that much hormone because you're not really addressing the conversion and the mechanisms that are going to assure that patient gets rid of the symptoms. So that's all that I have for you today. Please like the video, share it if you know anybody that's suffering from these problems. With all the love in the world, Dr. Valdes. Thank you.